Okay, good afternoon, everyone. I'll be presenting a case on bilateral persistent fetal vasculature, the unusual suspect. So coming to introduction, PFV was earlier known as PHPV, which is a congenital ocular anomaly in which the embryonic hyaloid vasculature network fails to normally regress partially or completely. Genes and factors that have been proposed in this mechanism are loss of WNT7P signals in hyocytes, factors such as angiotensin 2 or P53 that may affect endothelial cell apoptosis, deregulated vascular VEGF, and the absence of ARF tumor suppressor. It is usually unilateral and seen in term infants. Very rarely, bilateral presentation has been demonstrated by Pollard and Haddad et al. Systemic conditions such as trisomy 13, 15, 18, Norris disease, Peters anomaly, Warburg syndrome can be associated with bilateral PFV. Clinical presentations include leukocoria, nystagmus, microphthalmia, grayish membrane on the pupillary margin, retinal detachment, and vitreous hemorrhage. Very rarely associated with retinoblastoma, Peters anomaly, persistent pupillary membrane, retrolental fibroplasia. It is predominantly a unilateral condition. Bilateral cases account for less than 10% of cases in the literature. Purpose of this study is to present a rare case on bilateral PFV. And coming to the case report, an 8-year-old child came with chief complaints of gradual, painless diminution of vision in both eyes. He had involuntary movement and inward deviation in both eyes. History of spexing since 2 years. Birth history was full-term normal delivery with history of consanguineous marriage. Birth weight was 2.5 kg. No history of NICU stay and normal developmental milestones. The vision unaided was finger counting 3 meters equal to, and with glasses was 330 parts. So on ocular examination on Hirschberg's test, right eye esotropia was seen 20 degree. On cover uncover test, he had alternative esotropia with manifest pendular nystagmus. Microcornea was seen as the vertical diameter is less than 10 mm. And rest on torchlight examination, AC, iris, pupil and lens was normal, but on slit lamp examination, dilated, we could see peripheral cortical spokes in both the eyes. So coming to fundus examination, a thick band was extending temporarily to the optic disc. There was a macular fold with underlying RP changes in both the eyes on 360-degree fundus view. And B scan was done, which showed a color, axial length measuring 18.99 millimeter in right eye and left eye 19.47, suggesting microphthalmia. Also, the stalk was seen, leaving the vitreous and the lens clear, but the macula was seen on the fold. So how is our case different from others? This patient had a very late onset of presentation. The stalk extended temporarily to the optic nerve head. Also peripheral cataract was seen, and the patient had very poor visual acuity with alternate esotropia and nystagmus. So basically in discussion, very few cases of this are seen, and we have to also rule out early diagnosis and appropriate treatment, which would prevent progression of visual loss later in life. So yeah.